Hello, guys. My name is Valerie, Nurse Valerie Okaram. I'm a content creator at the Midwife Notes. Yes. So I made a post on pelvic inflammatory disease, and I've gotten so many reactions and questions about it. In fact, some people were asking me if it's curable, and some were asking me if it's treatable, and some were asking me so many questions, so many funny questions. And I would like to address one of the questions that I've been receiving frequently. Pelvic inflammatory disease is sexually transmitted. Especially, there are two sexually transmitted infections that can cause pelvic inflammatory disease: gonorrhea and chlamydia. Gonorrhea is more severe than chlamydia, and if when you are infected, when your pelvic inflammatory disease is caused as a result of chlamydia, you may be asymptomatic. You may not really experience the symptoms like gonorrhea. You may not even know that you have it. So number one, the first thing, how will you know if you have it or not? The first thing is testing, regular testing. If you're sexually active, it is advised that you always go to hospital and test yourself. Secondly, make sure that when you're testing or when you have the symptoms, like I've stated the symptom ranges from fever, offensive vaginal discharges. You'll be having difficulty in urinating. Some You'll be having pain at the pelvic region, and so many other symptoms, like sometimes you have back pain, you'll be having chills, and some people normally complain about severe pains when they are having sex, and offensive vaginal discharge, as I've stated earlier on. So these are more the signs and symptoms of pelvic inflammatory disease. And one thing about pelvic inflammatory disease is that it can cause infertility if not well treated. It can cause infertility. The one of the complications is infertility, ectopic pregnancy, and it can also cause you chronic pelvic pain, prolonged pain. You'll be having recurrent pain. Even after treating it, you'll be having recurrent pain. So how does it cause infertility? When there's an inflammation, is the infection travels from your vagina to your uterus to your fallopian tube. It causes an inflammation. Then it blocks the fallopian tubes. When your fallopian tubes are blocked, it prevents the sperm from reaching the egg. When you ovulate, even if the sperm manages to go there, it may, after fertilization, it may not come back for implantation, and that is when you start having ectopic pregnancy. And sometimes when the sperm is in situ, it may not even travel because the fallopian tube already has been blocked, so it may not even travel to meet the egg for fertilization. So that is where the infertility comes in. So the long-standing infertility, ectopic pregnancy, like when the sperm manages to swim and meet the egg, there is multiplication of cell. There is cell multiplication. The cell that has been multiplied may not pass because that place has been narrowed. That place has been blocked. It may not pass. So now, when treating pelvic inflammatory disease, I always advise young ladies, I also always advise people, you treat your partner. That's why people now ask, is it curable? Is it treatable? The thing is that you treat it. You don't treat your partner, and your partner reinfects you again, and you treat it, and you go back to the same person, and he reinfects you again, and you treat it. The cycle continues. So when you're treating any sexually transmitted infection, you treat your partner, You take your partner to the lab, you treat your partner, you encourage him because he may be the person that has been reinfecting you and you think that it's not curable. It is curable, it is treatable, but you need to treat your partner. And secondly, you have to maintain one sexual partner or you abstain. I always encourage abstinence. Abstinence is the best. When you abstain, no, the infection will not fly to come to your body, especially if you're a young lady, if you're not married. Abstinence is the best. Secondly, you have to educate your partner not to have other partners, because sometimes when you treat yourself and you treat your partner and your partner have other sexual partners, multiple sexual partners, those people might infect him again and he will not infect you again, and the cycle continues and you will be thinking that this disease is not curable. I've gotten DM people telling me that they've been suffering it for 5 years. Some even told me 8 years she has been battling it. Like, you've treated it, you went to lab and you were treated by a doctor. No, you were infected. And more or less, those that are having the chronic pain is the complication, because I said earlier it has complication. So it's the complication sometimes that you feel that, okay, I'm still having this recurrent pain in my pelvic region. Is the complications, not really that you've not treated it. So now you have to, the way forward is that you have to maintain one sexual partner. First of all is abstinence. Then secondly, you use protection. You have to protect yourself. Thirdly, you have to maintain a sexual partner, one sexual partner. Or fourthly, when you're treating yourself, you treat your sexual partner, you treat your partner. Ensure that you treat your partner and ensure that your partner doesn't have other sexual partner. And you have to stop multiple sexual partner, because when you treat one partner and you meet another partner, that other partner may reinfect you. Maybe the first time you had it with chlamydia, the second person now give you gonorrhea. Apart from chlamydia and gonorrhea, there are other bacteria that can cause pelvic inflammatory disease. You have Staphylococcus streptococci. You have even this Haemophilus influenza can cause it. So you may be suffering with the one that is caused by gonorrhea. Another person will infect you with the chlamydia. Another person will now give you the staphylococci infection and all that, and you have the treatment becomes more complicated. You might even have antibiotic resistance. So pelvic inflammatory disease is curable, but it is preventable, because prevention is better than cure. It pays more to prevent disease than to cure it. So I will encourage you, if you can abstain, better. But if you cannot abstain, play safe, protect yourself. Secondly, encourage your partner to be treated. Ensure that you treat your partner. It is treatable. That's why you think that it's not treatable. Thank you.